muscle. The potential problems with the cardiac muscle itself is thickening. Primarily this occurs either from genetics or often from high blood pressure. And what happens is the heart, of course, has to work much harder to eject and get the blood out into the body when the blood pressure is high. I always like to use the analogy here of think of a garden hose and a plastic bag. If you had a plastic bag of water and you were going to squeeze it connected to a garden hose, the water would squeeze out quite easily. Now, if instead you connected a tiny little straw to that bag and tried to squeeze that same water out, it would be much more difficult to squeeze that bag and get the water to leave the bag. That's what happens with high blood pressure. As the vessels become smaller, the heart has to work much harder to pump the blood out into the vessels around the body. So that's what happens when it leads to thickening of the muscle. And what actually happens then is the chambers, earlier I said we can compare these to rooms in our house, the chambers then become too small. The muscle actually grows and starts making those rooms smaller and smaller, so less blood can be ejected with each heartbeat. And that's what we call ejection fraction. And you might have heard your doctor talk about that. It's honestly, quite simply, just the amount of blood that's able to be pumped in one heartbeat from your heart. And again, ejection fraction is very important. We want to make sure that we're getting a sufficient amount of blood out into the body to carry oxygen to the tissues that we need. And then last, but certainly not least, valves, a very common issue for patients when they have valve disorders. We've heard about patients that get artificial valves. We've all heard of heart murmurs. These are leaks when the valves don't seal quite tightly enough. When blood flows from the atrium into the ventricle, the valve is supposed to close behind it to keep that blood from coming backward and going upstream in the heart. When those valves become defective, it leads to either valve defects where we need an artificial valve or we need valve surgery, or leads to a heart murmur that we hear quite frequently.